Can you hear me now?
No,
Can't hear me?
barely. Can you hear me now?
I can hear you.
Okay.
Can
I'll
ev-
try that then.
Thumbs
Can you
up.
see me? Oh, yes, okay.
Thumbs up if you can hear me. Yeah, can you hear me well? Yeah, oh, everyone's using emojis. Amazing, everyone's got their camera on, almost everyone, but that's okay. I'm on the main screen, yeah?
Yeah.
Cool, you can see me. Very good. Just waiting to see if anyone else is going to join. We've got a few people, which is great. Thank you for joining. Just testing a few things. Okie dokie. Well, let's get started.
Daniel,
Yeah,
you talked about the book.
yes.
How do we get the book?
So that book is in the thank you page, in the link in the emails. You can download it onto your computer. If you haven't got an iPad or something like that, you probably can't write on it, obviously, unless you print it. You don't need the workbook. You can just take notes if you want, and you can go back to it.
Okay then.
Yeah, you can go back to it.
Because I put it on my computer.
Yeah, that's all right. Yeah, so you can just
It doesn't. I can't download it onto my computer.
yeah, that's okay. It's just it's a PDF, but if you don't have it, that's okay. We are going to do a little bit of work today. You're going to be writing some stuff down, so you're just going to be planning out next year and how to be FracFree next year. So it's not a webinar. This is actually a workshop. So a webinar would be that I gave you some information and then sold you something. We're not doing that. That's why there was a cost initially, because it's actually a workshop. You're going to be doing stuff and you're going to have a program at the end of it. You'll learn about what osteoporosis is and all that kind of thing. And then at the end of it, you got something to take away. So there's no selling or anything like that. This is just give you information, basically.
I've got very strong bones.
You have?
Yes.
Yes. Good. We'll go through that, Elizabeth, in a little bit.
I've still bent over, as you all know.
Yeah. Good. All right.
They told me to join.
Yeah. So we'll learn some stuff, and let's get going as soon as possible. There was one thing I was going to do. Oh yeah. Just in the things at the bottom of Zoom, if you're not familiar with, you can put reactions. If you like something, click on the reactions. Give me a heart or something like that. You can see all that. Yep.
No. Oh, yes, just come up.
Yep, that's it. It's working. Angela's got it. You got your videos on. Thank you. Appreciate it. Just makes my life easier. I can see how you're reacting. Also, the chat's probably one of the most important things. We're going to use that a little bit. So the chat's down the bottom and you can type into that as well. That would be good if you could use that. If there is for any reason that you want to change your name to something else, you can do that and make it whatever you want. Does that make sense? Yes.
Yeah.
Cool.
What does your wife say about all the hearts?
She's in bed. What are you talking about? She doesn't get up this early on a Sunday. Thanks for coming on a Sunday, mind you as well. Let's get going here with FracFree Workshop. Everyone can see the worksheet there. Yep, got it. All right, let's go down. I've got a bit of a cunning plan going on at the moment, so I'm going to use my pen and we're going to go through this. Let's make it a bit fatter. So we got that. Whoopsie.
Daniel,
Yep.
do I need to sit down and take notes? This is an active one, is it?
Yeah, this is a workshop.
Yeah, so I stay on a mat. Yeah, it's okay. Thank you.
Yeah, you're good. Whatever's comfortable for you, obviously. That's a bit fat, isn't it? Let's make it a bit skinnier. So there's a few things we're going to do today. Obviously, this is a workshop, and there's a few different points I want to go through here. In particular, we're going to get you a plan for the next few months, or going into half of next year. We want to be consistent with that plan. We also want to make sure that you're good for the next 15 to 20 years with that plan. My pen, years. There's also something I'm a little bit, let's say it's probably 90%, 97% about you. It's about 3% about me. Just doing a bit of training, obviously, and helping you trust me to move forward with, obviously, other things in your life to do with health as well. So I do have a bit of a plan there. The green lines. So there's a few things going on here. We have a green line going up, and we have a red line going down. There's, we also call this two futures as well. So we have dots on each line. So basically we have a green line going up and a red line going down. So we want to choose which line we actually want to go on. So down the bottom here, we are on the red line, we are confused on what to do in terms of osteoporosis. There's so much information out there. Green line, we are certain of the plan of what we want to do. Red line, we have no plan whatsoever going forward. And on the green line, of course, we have a plan. On the red line, we are going to decline. We're going to go down quickly if you haven't got a plan to minimize bone loss. And on the top line, we want to thrive as much as possible. Makes sense, right? The actual game plan. So by the end of the day, you'll have a little program that you can work on week by week. You could probably do that for a few months and then alter that as well. So the game plan looks a bit like this. We need a few different blocks here. We're going to link those blocks. We want to identify what we need to do with you. We obviously want to move a little bit more. We want to nourish. We want to know what to eat. Yeah. We want to know your numbers, and we want to give you support as well. We have a little bit of bonus stuff. We got medications. We'll talk about them, and we'll also talk about hormone levels, which are important as well. That's pretty comprehensive, but we'll get through it relatively quickly. If there's any questions along the way, stick up your hand or ask in the chat, or just say, hey Dan, let's talk about something else. End of year snapshot. Let's have a look. We've got a bit of pride and gratitude. You can write down some stuff now if you like. I'm going to give you a minute. What are your top 3 best things this year that has gone on with your life? I know there are quite a few people in here that have had some struggles. You don't have to share those, but let's just, to actually move forward, we need to have a look back and see what actually went well this year for us. It puts us in a good mind frame. So I'll give you about 1 minute now to write that down, and away you go. Sometimes it is hard to think of the good things. We only remember the bad things, but there are there would be 3 good things that happen this year in your life. Don't think about it too much, just hook in, just write a few things that come to the top of your head. Ten seconds. All right. Cool, let's move on. What unfinished business do you have this year that you want to continue into next year? And this doesn't have to be to do with health. It can be to do with anything in your life, work, relationships, whatever. What unfinished business do you have? You can write a few points there. You can write a sentence. Give you 1 minute. Go. Why my minute coming up? 1 minute. Don't worry, I'm counting. There we go. Unfinished business could be do with anything in your life. As I said, we're just looking back to go forward, so we've got we're in a positive mindset. So we've got about 20 seconds. Hope you got a coffee or tea this morning or something. Ten seconds. Just the top thing that comes to the top of your head. I know it's like Sunday morning. I have to do work. It's not work. It's good stuff. All right. We're done with that. Next one, growth. Down the bottom. What are the biggest challenges you've grown through? What did you learn? You can still grow through things no matter what age. So let's have a look at that. You can write sentence or we can write points. And I think we're a go. Timer's on. Make it quick. Can be doing with anything that happened throughout the year, and there's always been challenges, and we can always learn from those as well. 30 seconds, nice and quick. Twenty seconds. Five seconds. And the last one, we'll have 1 minute. What are your top 3 aspirations for next year? Can be do with health, personal, relationships, work, exercise. Where's your working minute? You might have more than 1 minute. There we go. 1 minute. Just got someone else joining. All right, 40 seconds. Top 3 aspirations. Looking towards. It's better doing this now than actually doing it in the new year, because you never really do it in the new year. If you plan for it now, it'll happen in the new year. 20 seconds. Oh, Onying's on board. Welcome. We're just looking back. 3 aspirations. We did look back, now we're looking forward. What are your top 3 aspirations for next year? What do you want to do? Personal, exercise, things like that. We've only got 5 seconds. 4, 3, 2, 1. Burp. Does anyone want to share any of those? You can share them if you want in the chat, or you can unmute and share. It's up to you. You don't have to. All right. Let's sharpen it up. Sharpen your promise. So let's take these 3 aspirations, one in each section. On the left-hand side, dunk, 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 and then just write those 3 in there for me. I'll give you 1 minute. You don't even need that to do this. Just write it down. So in Sharpen Your Promise, we're just writing the 3 here for next year, 3 aspirations.
I don't quite understand what you mean. You know, I've written down my aspirations.
Yeah, good, good. Yep, that's where we're at. You're right on target, Elizabeth.
Okay.
Right on target. 20 seconds. We're going to move across to the next column here. We're going to pick one in particular, and we're going to point to it directly with a result. So you're going to pick one in particular, and if that sort of aspiration does come true, what would be the result, the end result? What's the good outcome that will come from that? So just write that down there. Don't take too long. Nice and quick.
Did you want something for each one of them?
Nah, just pick one. Well,
thank you.
Have I frozen? I have. Can you still hear me?
We can hear you, but
Yeah.
you are frozen.
Yeah. Just bear with me. What are you doing, camera? Sorry, get back on board in a minute. Here we go. Can you see me again?
Yes.
Yes.
All right, cool. So we've got the result. We've sharpened the promise. This is what we're working towards next year. Very good. All right. Have you seen this document yet? Strong Bone Focus Finder. All right, one red light, green light. So in the chat, you're going to use the chat icon down the bottom. Get ready to type. So you're going to type green, yellow, or red on the top one. So I do at least 2 to 3 training sessions per week. Let me know green, red, or yellow in the chat down the bottom. Got a lot of yellows, a couple of yellows at the moment. Anybody else? Green. Oh, we're going towards green a little bit more. Very.
So we're supposed to let you know, are we?
Yeah, let me know in the chat. Green, yellow, or red.
I've got green. I've got green for everything except the second one.
Good, good. Excellent. I include daily weight-bearing movements, brisk walks, and dancing. Let me know in the chat.
Oh, was supposed to do it there. Mm.
Yeah, there's a chat. There's text in green. Yep. Oh, we got some green. Nice. Very good.
Yeah, I just lost it.
There we go. It's back.
How do I get the colours?
Sorry?
How do I get the colours, Daniel?
Don't worry about the colours. Just type in green, yellow.
Oh, right.
Just type in green, yellow, or red, and I'll do the colours. Okay. I practice balance.
Sorry?
I practice balance during the day. Balance drills or something.
Does that include walking?
No.
What does it include?
Like heel toe standing, standing heel toe, standing on one leg. A few yellows, a few greens.
I don't like using this chat.
Okay, that's all right. You don't have to.
I'm all green except for...
All right, I gotcha, Elizabeth. Just shout it out. Nourish. I get enough calcium and vitamin D through the day. Green, yellow, or red? Ooh, lots of greens. Very good, very good. I eat enough protein and nutrients that support bone. Few yellows, greens. I think so. You got to put a color in.
Oh, okay.
You got to put a color in. It doesn't work. I limit alcohol and don't smoke. Ooh, lots of greens. They're healthy people. Let's go down to no. Have a bone health check, a DEXA scan. I'm 45 years plus or have risk factors. Greens. Just such good people. I understand how menopause, family history, or medications impact my bone health. Greens. A few yellows. There's not many reds, which is good. I know my personal risk level and what to do to maintain or improve bone density. Ooh, yellows, yes. Suppose generally, if you're green, you probably wouldn't be here, maybe. Support, I regularly see a health provider, EP, GP, dietitian, etc. Greens. Good job. Have a simple weekly plan to stay active and look after my bones. A few yellows there. That's all right. Very good. I feel supported, confident, and in control of my bone health. Last one. And need a little bit of help on that one. Thank you very much for going through that. Gives me an idea of where we're at. Let's have a look at this. So we've got hot button map. May have gone through this with you in the clinic. We got our wants here. We've got our frustrations. Just going to make that a bit thicker. We got our aspirations here. And we got our fears here. Up here is immediate. I'll go through this in a minute. And this is imagined. This is now, and this is the future. So we have two paths here. So we can be on this trajectory on the green, or we can be on the red going down. So you can write down some of your wants. What do you want in the next 30 days, 60 days? Generally this is in regards to health or exercise. So just write a few dot points down. What do you want in regard to wants in regards to exercise in the next few months? Don't think about it too much, just pop it down. All right, what are your frustrations right at the moment that you have? Whether it be a mobility thing, you can't move as much as you would like. Maybe it's your strength, getting out of the chair, walking long distance. What are your real frustrations right now? All right, give you 10 seconds on that. What are your aspirations, top right-hand corner? What do you want to be able to do next year or in the next 5 years in terms of mobility, exercise? Could be travel as well, travel a little bit more. You bring coffee for all of us? Where's mine?
White with one.
White with one? No, just black. Whenever you're back. Okay.
Oh, she needs some drugs.
Yeah.
Thanks, Tom.
What are your aspirations? Give you 20 seconds. What do you want to be able to do next year? Play with the grandkiddies a little bit more. Get down low onto the ground. Get up again. Run with them. Whatever. And what are your fears? What are you worried about? Bottom right-hand corner. What are you worried about? Told you I wasn't going to sell you anything. I was going to get you to work. What are you worried about next year? What are you worried about next 5 years, 10 years? Are you worried about losing your mobility? You're worried about not keeping up with your friends, keeping up with family, not being able to go to the gym 6 days a week like Elizabeth? What are you worried about? All right, give you 20 more seconds and we'll be done with that. All right, let's move on. Okay, we've got a bit of an idea what we actually want, which is important when you're doing a bit of a workshop and trying to plan out, what we're going to do next year. Does anyone want to share? You can share if you want. You can share in the chat. You can yell it out. It's up to you. If you don't want to, that is okay. So the Strong Bones Focus Finder, we're going to go through 4 of the different things with a bit of an add-on. So we're going to go through move, nourish, know, and support. And we're also going to add medications with that and also hormones. Is that okay? We're going to whip through that now. Alrighty. Move, probably the most important thing that we're here today is trying to get you an exercise plan to keep you moving as much as possible, but we got to learn how to move properly and what are the components of actually moving during the week. So at the end here, you'll have a weekly plan to move during the week and going into the future as well. So we're going to block this out a little bit. We're going to go to a 30,000 view and have a look. So we need 2 to 3 strength sessions a week. at least. I'll say minimum 2. Minimum 2 sessions a week. Definitely 3 is good. How many do you do, Elizabeth? How many a week?
I don't.
Elizabeth Hannon? How many are you on a week?
Well, I go to the gym, 4 times a week, 3 times a week, hydrotherapy, all 4 times a week.
Okay, yeah, perfect, good. So probably 2 is the minimum, strength training. Anything more than that is really a bonus, which is great.
What do you mean by strength training?
Yeah, good. We'll go through that. Good question. Thank you, Colette. You're getting ahead of me.
Oh, sorry.
So we want weight bearing daily as well. So we'll go through that in a minute. And we also want to balance exercise daily as well. So a strength training exercise involves moving weight, whether it be your own body weight or whether you're moving weights in a gym. It's not walking, it's not gardening, it's not working around the house. It's actually moving resistance, because that's how you actually put strain on your bones.
What about wearing a weighted vest?
Oh, okay. Dude, you're getting too fast. We'll get there. Good questions, though. Good questions.
Also, Dan,
Yep.
Do you count stretchy bands as weight? Or?
Yes. Yeah, not as good, but it's a good start. Yeah. So I'm going to write a few exercises down here: squats, lunges, hop and land, which is a little bit of a jump. Any kind of rows, you may have done that in the gym. I might have shown you that. High row. So we're using both upper body and lower body. A calf raise. This is probably the bare minimum that you need to do. So a little bit of leg exercise and some upper body exercise. And really, if you had a program of 5 exercises like that, it'd probably take you about 10 minutes a few times a week. So it's not a lot. If you're not doing that at the moment, you probably should be doing that. So I'm getting back to what Colette was asking in return into weight bearing exercise. So weight bearing at the bare minimum is walking. But we want to actually do some rucking. Does anybody know what rucking is?
No.
Colette?
No idea what rucking is.
You mentioned it before. It's wearing a weighted vest.
Oh, right.
Yep.
Oh, I have started doing that.
Yeah, good. So one of the best things you can do if you do walk is actually wear a weighted vest when you walk. The reason you could do that is because it provides strain down your whole body rather than just your own body weight. So you can get weighted vests from most fitness stores. I think you can get one from Rebel, you can get one from Gym Quip out at Fish Week. You can buy them online.
Order it online.
Yeah, yep. So there's a different.
What do you suggest?
Sorry?
What sort of weight do you suggest?
It really depends on how you can handle. Probably minimum sort of start off with maybe 5 kilos, depending on how the weight vest adjusts. Some have little pockets that you put in, some have plates. But you want to try and get up to a good percentage of your body weight, maybe 10% of your body weight up to 20% of your body weight, which is quite heavy when you're not used to it. So rucking. You can also do stairs as well, regularly every day. If your
Say
knee,
that again.
you could do stairs
Yes.
as well. If your knees allow you to do stairs, you could do stairs. This is daily. This is daily movement. This is something you need to do every day. And we're talking about bone health here and putting a strain on your bone. I'm just going to scroll down a little bit here. So yeah, I just added stairs there. Scroll. So the difference between stress, I should put strain up the top and stress on the body. So if you can imagine if you're walking a bit funky and you've got a sore toe, that would be stress on the bone on your toe. What we want with bone building is we want strain. So we want strain through the bone over a period of time. And that's what something like rucking does, walking does, stairs does, weights does. It's put strain on a loaded area over time. Say like the long bones, the femur, the hips, the humerus in your arms bones. So it's putting strain on the bone over time rather than an area of stress. So we want that strain to happen over a period of time. We also want to balance. Yep.
I don't do that because
Yep.
I don't want to damage my pelvic floor.
Yeah, I gotcha. It's going to be individual. So you still put strain on your body by doing the weights, Elizabeth. So, and you almost do something every day as well. So that's.
And I do those sitting down.
Yeah. Yep. Okay. So again, it depends on the function that you have, but you're doing what you can in regards to that, and that's what we want. Working on your balance. So this could be a heel toe balance. So just standing with one foot in front of the other and try and hold that for 30 seconds. Or you could balance one leg as well. So you're just standing on one leg. You can do that for, 10, 15 seconds as well. Pretty straightforward. You can incorporate your balance into a walk or a ruck or some stairs or something like that as well.
By stairs, how many up and downs do you mean?
Yeah, I mean, it depends on, whether you've got a house that's got stairs or whether you find somewhere that's got stairs. So I'd spend a good sort of maybe start off, depends on your knees and your hips, 2 to 3 minutes up and down stairs. It's not long. Every day, depends on the length of stairs as well. If you've only got 3 stairs, up and down, or just stepping up one step, step down, up one, down one, up one, down one, as long as your balance is good as well. So spending, 3 minutes, 5 minutes with a bit of load, obviously more the better. Colette, if you're pretty active anyway, if you're walking around a lot, you're going to get a little bit of loading. Again, walking, unless you have a problem walking's just not enough. So we need to do a little bit extra, which is why we've got the strength training and a bit of balance. And if you can, a little bit of rucking. Just on the rucking, so holding hand weights doesn't work as well as actual putting on a weight vest that's close to your body, because it kind of throws you.
One of those.
Yeah, perfect. How heavy is that?
4 kilos. My husband bought me 10 kilos, but I could hardly lift it.
Yeah.
So that's the 4 kilo one.
Yeah, nice, very good. Ankle weights don't really work when you walk. You can do them as exercises, just if you're doing stairs or whatever, with ankle weights, lifting your legs up and down. But actually going for a walk would actually probably throw your gait out a little bit. So probably not recommended. Better to get a weighted vest as well. Any other questions on that? That was quite good. A lot of questions. We'll get back to the program at the end as well. Okay. Let's go. Nourish. Food. We all love food, hopefully. Let's go through a few things in Nourish. We're going to talk about, what color are we going to do here? We'll talk about calcium, vitamin D, protein, alcohol, did I spell that wrong? Smoking as well. Calcium, how much calcium do you need a day on average? Anyone know?
I take 1 caltrate.
How much in
1
that?
caltrate tablet. I think that's 1,000
Yeah, okay.
with vitamin D in it.
Yep, okay. So calcium, probably about 1,000 to 1,200 milligrams a day. Vitamin D, speak to your GP about vitamin D, but probably about 1,000 UIs a day, units a day. I take 5,000. Vitamin D is important for bone growth. So if you're not getting in the sun much, probably need to up your vitamin D, but yeah, talk to your GP about that. Let's scroll down. We've got this here. I don't know if you could see this. Yeah, so women here over 50 years, about 1,300 milligrams per day is recommended on this. As you get older, and we'll go through this soon, calcium gets absorbed less in the intestine than it would normally. So if you're looking at serves of calcium, milk, cheese, yogurt per serve anywhere from 150 to 300 milligrams. Seafood, depending on the size, up to 300 milligrams. Vegetables, depending on that, you could be up to 1,000 milligrams. Nuts and seeds, about 100, and the rest of them. Chicken, about 100 milligrams per serve. So you get calcium in a lot of things, and it sort of adds up to the end of the day. You can take a calcium supplement, like mentioned. Only becomes a problem if you've got sort of heart issues. It can build up a little bit of calcium in the heart as well. So just make sure you're aware of that. And yeah, if you're taking a calcium supplement plus you're eating well, so you're probably getting a lot of calcium. So it's best to get a calcium score done of your heart. So they just scan your heart and tell you how much calcium buildup is in your heart as well. Let's move on to protein. Do you know how much protein you need during the day based on your body weight? Anybody know?
No.
So protein, we need 1.6 grams per kilo of body weight. So you take your body weight and times it by 1.6, and that'll give you how much protein you need during the day. That's a lot. That's minimum. You go up to 2.2, which is quite a lot. Could go down to 1.2, but it's recommended 1.6 grams. So if you think about that, take your body weight. So if you weigh 70 kilos, just grab my calculator. So you go 1.6 times by 70. So you're looking at 112 grams of protein a day. So if you have one of those protein drinks, it's about 30 grams. So have a little bit of steak. It's probably about 20, 30 grams as well. So it's quite hard, especially as you get older, to get the protein into your body because your digestion might not be as good as well. So you kind of need that amount of protein to minimize muscle loss and keep your bones strong. So it is a bit of a struggle, but you can work out over the next maybe few days to actually how much protein you're taking. So one piece of steak is not 100% protein. So you can't just weigh the steak and go, oh yeah, that's if it's 100 grams, it's not going to be 100 grams of protein. So I think you can look up the stats of how much, you know, a piece of chicken is, a chicken breast or whatever, and how much protein's in that. And you can estimate how much protein you're getting a day. Let's go back slightly. So we'll fill in. Here, protein, we got 1.6 grams per kg BW, 1.6 grams per kilo of body weight. And of course, we don't want to be smoking or drinking too much alcohol at all, I think we all kind of said that was, nobody was really drinking or smoking too much, which is good. Let's move on. Calcium, protein, don't drink or smoke. All right, let's move on to no. This is kind of fun. Your DEXA scan. Hands up who's had a DEXA scan here. Ooh. Who needs to have one? Excellent. Okay, know thy numbers. So do you know your current DEXA scan results? Does anyone want to shout them out?
I don't know.
Or put in the chat?
Don't know.
Don't know. Cool. Who's had theirs done recently? Do you remember? Jenny? Do you remember? Can't hear you, Jenny. Type in the chat. Unmute you. I'll unmute you. Maybe Jenny, can't hear you. Maybe your microphone's not working. Don't know. That's all right. Type in the chat. Just tell me a number if you got it.
I've had it, and the scans have come back. I've got excellent bone scans.
You don't remember the numbers, Elizabeth?
No.
Yeah.
I don't know mine either.
Okay. Probably good if you've had the scan just to look back and see what they were. So normally, if you, we'll go through this in a minute, but if you do get the scan over the next few months, you usually get one single hip scan or double hip scan, and you'll get your spine scanned as well. When you get a DEXA scan, make sure you go back to the same spot, the same machine every time, because it is a picture and you're not actually going to be sitting or laying exactly the same way every time you get a scan. So the picture and the equation and what they work out is going to be slightly different. So you could go once and there'll be a different picture the next time, and you may have increased bone density, you may have lost bone density if you don't go to the same machine. So try and go to the same machine as much as possible.
My lumbar spine BMD is 1.315 G centimeters. T-score is 2.3, Z-score 5.4. Femur neck is BMD is 0.964 grams G stroke CM. And just found out that I had no osteopenia or osteoporosis was identified.
Wow, you're lucky.
I'm very lucky. But I'm still getting over.
What was your T-score on your hip?
2.3.
2.3 on your hip, was it?
It's in lumbar spine, actually.
Yeah, does it say your hip?
No. Femur neck.
Yeah, what's that?
Maybe I'll look up something else. I've got it on the computer.
Yeah. Okay.
My X-ray scans.
Yeah. Okay, well...
The bone density, 10th of October. Is that the one I just said?
Yeah.
That's the 10th of October. Go back to
Okay.
another one.
All right, let's have a look at this.
And then I had bone scan whole body.
Yeah.
It's the 30th of September.
Okay.
Report.
All right, we've got a scale here.
I've got no button. I've got a problem in the facet joint.
Yeah, all right, cool. So little scale here. On the left-hand side, we've got age. So we've got 0, and on the right-hand side, we've got 100. We'll just make it 100. And we've got bone density up and down the scale there. So in terms of bone density, we could be up around +2 on your scan, +1 here. Down the bottom, we've got -1, -2, -2.5. Sorry, just have to change something here. Yep. So as you are born, you increase bone over time. So they're osteoblasts. They build, they're the cells that build bone. So you'll start off down the bottom. What color do we want here? Let's go green. So you'll start building bone, and you might sort of get up to here. This is the age of 30, right in the middle. So that's when your bone hits peak bone mass, anywhere from 25 to 32 for a woman. Peak bone mass is around there, and it might be +2, +1.5. We got your ages here, so let's go 40, 50, 60. There. After that, we have a quick drop off there, and then I'm going to change it to red because that's dramatic. So we're going to drop off like that. That's kind of a normal curve. So up until the age of about 25, 30, you're building bone. And then after the age of 30, 35, you are forever losing bone from there. So,
For me,
sorry?
but for me, since the study of January 2024, this was study 2025,
Yeah.
there's been an apparent 5.1% annualized increase of bone mineral density in the femoral neck and 1.6% increase in bone mineral density in the lumbar spine.
You taking the same picture of the same machine?
Yes.
Yeah. Are you on any medication?
Well, I'm really
For bone?
No, don't think so.
Your bone is, when you go, your bone is down to 2.3, so it's down here. So that's just normal. That is normal. That is normal decline. So you were up here probably when you're, 30, and now you're down here.
It's interesting it's improved.
Yeah, so there's a few factors that go into that, obviously. It's the picture that gets taken as well. But generally, it's really hard to increase bone when you're in your 70s and 80s. Really hard. And we'll go through that in a minute. So the decline, it's hard to, you can't stop the decline. So once you're at 35, 40, your bone density will rapidly decline. So normal bone density is +1 to -1, when you're sort of 30, -1 to -2.5. So down in this area here is osteopenic.
Ryan.
You're down there? Yep. So bones are weaker than normal, and there's an increased fracture risk. Greater than 2.5 or less than 2.5 is osteoporosis, significantly reduced bone density, higher fracture risk. Now we're just talking about a T-score here. So a T-score measures you against you when you were 30. So again, when you're 30, you're up at, +1.5. Whoops. You're up at, up here. And now it's measuring, the scores now are measuring you against that. And more than likely, most of you would be around the -1 to 1.5 to 2, I would think. Greater than -3, severe osteoporosis, very high fracture risk, often requires medical and exercise intervention. I would say you need exercise intervention at all stages. Women lose bone more rapidly after menopause, 2.5% per year initially after menopause. which is why T-scores often drop in your late 40s to 60s as well. What is a Z score? Does anyone know what a Z score is? Elizabeth, what was your Z score?
5.4.
Negative or positive?
I think they mean positive because they said there's no osteopenia or osteoporosis identified.
So your Z score compares your bone density to other women your same age, sex, and ethnicity.
I got two Z scores, a 2.7 out of 5. The femoral neck
Yep.
is 2.7.
Yep.
The Z score, the lumbar spine is 5.4.
Yep. So above -2, generally considered within the expected range for your age. Below -2 suggests something other than normal aging may be affecting bone loss. So usually use Z scores for younger people, younger women. So probably in the ranges of 40 to 50, we use a Z score. More important.
5.4, where is that?
That's in plus, so you're doing well compared to people your age.
Osteopenia.
Yeah.
Thank goodness something's good.
You're good, Elizabeth. You're good. You can use Zoom. That's good.
I'm still bent over.
I know.
I can't run.
You got to keep going. Yeah. Well, if you're chased, you'll probably still be run. You could probably run still. Yes, Z scores. Yeah, so mainly women under the age of 50 we use Z scores for. We're trying to work out why their bone loss is so significant. Few final points. Osteopenia becomes very common after the age of 55 to 60. So it's not uncommon to have osteopenia at that age. It's whether we, go into osteoporosis is probably the important thing.
I want to stop that.
Yeah, that's why we're here. Exactly, yeah. So what we're actually doing in terms of stopping, and we'll go through this in a minute, is bone loss will happen. So your osteoclasts, which are the cells that eat bone, are outdoing your osteoblasts. They're the ones that build bone. So initially the osteoblasts were working really good here, increasing your bone, and now the osteoclasts have taken over. And there's various reasons for that we'll go through in a minute. But you're trying to get this balance, but you're kind of losing the fight when you get older. It's very hard, so you want to just minimize the loss. That's what you're doing. You're minimizing the amount of bone that you lose. So if you were 100, 120, everyone would have osteoporosis. Very hard to avoid. Very hard to avoid. What matters the most is your T-score. So you want diagnosis for normal osteopenia or osteoporosis. That determines your fracture risk and is often used in treatment decisions. If you've got a low Z score, if you're a little bit younger, you have to look at your hormone testing, look at your nutrition, and maybe screen for early menopause or inflammatory conditions as well. And also a review of medications over time as well. Any more questions on that? Jenny, no numbers. I used to be in the middle. No numbers, Jenny. Yeah, that's okay. In the middle somewhere. You don't want to have a DEXA scan too often. Obviously, a bit of radiation there. So probably, once every 2 years, maybe, with a DEXA scan. Get rid of that. Go away. Okay, let's move on. We're getting through. How are we going for time? 9:30? Very good. Risk factors. Yell some out to me. What's going to give you a risk factor of losing more bone? Yell them out if you know any.
Lack of exercise.
Yep. Perfect. What else? We'll put them in red. We all know smoking's one. What else?
Alcohol.
Yep. What else?
Sedentary lifestyle.
Yep. Sedentary. Lack of protein. Menopause.
So what you're saying, we need to start taking protein drinks rather than just the vegetables and that we
I'm not saying that. I'm just saying that have a look at how much protein you're actually taking. Some people can't stomach more protein just because of their digestion. So you just have to look at that. But generally, especially women are not eating enough protein. Maybe your genetics could have a play. We did medical steroids at a young age. Also lack of movement when you're younger. It's a bit of a problem with the teens today, huh? Lack of movement. Because that's when you build all your bone. That's when the osteoblasts are working most up to the age of 30. That's when you're impacting, and that's when your bone density is established before the age of 30. Any others there that you can think of? Rightio, let's move on. Support, where's your supports at the moment? We obviously want support from a health practitioner. So that can be a GP, EP, physio, nutritionist, dietitian, someone like that. We want a weekly plan. Come on, Dan. And you want to feel like you're in control of what you're doing. You want to feel like you're in control of your life in terms of a plan moving forward as well. Everyone got good supports? Hopefully. Not just our team, but other supports, nutritionist, dietitian, things like that. Very important. Let's look at a little... Sorry. Let's look at medication. What medication? Is anyone on any medication for bone loss? That would be Fosamax, Prolia, anything like that? No? We're trying to avoid medication as much as possible. So we have 3 buckets here. Let me just do this. So in your buckets, we have we got bone keepers. Actually, I might put these up the top. Bone keepers. Are people familiar with Fosamax as a drug? So it's probably the most common bone drug. So that's taken weekly as a tablet. Or
that's something that's prescribed, is it?
Yeah. Yep.
What is it again?
Sorry?
What did you say it was?
That's Fosamax is the generic, not generic term. So there is chemical terms. It's either alendronate. It's ALENDRONATE. ALENDRONATE, or risdronate. It's RISEDRONATE. They're the most common ones. So it's basically Fosamax. It's taken daily or weekly or monthly prescription. So the bone shield tablets that slow down the cells that chew up bone. So they're slowing down the osteocytes. So we got osteoblasts that build the bone, and then we're trying to minimize bone loss. So it's just trying to minimize bone loss. So it's actually not building bone. It's minimizing the bone loss. So maybe the osteoblasts have a chance to, because you're still building bone if you're moving. So you're still trying to build bone. You're trying to fight bone loss. Great at reducing fracture risk, but can upset your gut and need to be taken in a precise way on an empty stomach. And you need to stay upright when you take these medications.
So is that something that we ask our doctors?
No.
The doctors would have prescribed it if you needed it.
Yeah, and it's probably overprescribed because people aren't moving and aren't exercising. So this is just general knowledge. So if you are doing all the other good things like exercising, eating well, you probably discuss it with your GP, but you want to try and avoid these drugs as much as possible, if possible. I'll tell you when you actually need them in a minute. You can also get, with the Bone Keepers, you can also get a yearly drip as well. Yeah, it's a once a year IV drip that does a similar job to the tablets, handy if the tablets or if you've got reflux or something like that. You get a 6-monthly needle. You may have heard of this one, Prolia. So acts a little bit differently. The clinical name is Denosumab. That's DENOSUMAB. So that's a 6-monthly injection. A lot of people get the 6-monthly injection. The twice-a-year injection that very powerfully slows bone loss. Works well, but you just can't stop it suddenly. When you do stop, you usually need a plan to move on to a different medication so the bone doesn't rebound and actually weaken you.
So if you're not on it, if your doctor hasn't prescribed it, they don't think you need it, or what?
Yeah.
Or you need to check.
Probably. You probably would have known. The GP would have asked you a few questions. Are you exercising? And have a look at your T-score and see where you're actually at. If you're in the sort of negative 2s, then you probably won't be suggested. There's another one that's a tetrapeptide, which is a daily injection for 2 years. Not as common. There's also monthly needles, which is called Evenity. That all these. So there's also, those ones are actually bone builders, the ones I just mentioned. So we got bone builders, the next bucket. So the bone builders actually make new bones. So these are tritepatide, tiny injections every day for 2 years. And also the Evenity, which are monthly needles for 12 months. So you would only get the bone builders if you were in a nursing home, really inactive and not moving. Because when we say bone builders, so the bone will lay down based on the activity that you do. So if you're in bed every day and you have bone building, it'll just build in places that you don't want. So in your jaw, it'll lay down in your hips, but it'd be very unfunctional. So not really a great thing, but it will make you a little bit more stable, but it's not really functional. When you grow bone, you're always growing bone, but obviously the loss is greater than the bone growth. You want it to spread evenly amongst the bones. So you want it right in deep into the bones, into the cortical bone, but also spread throughout the bone like you would be walking or moving. So the bone builders are like a renovation crew that come in when the house is very fragile and has repeated fractures. So if you've had someone in the past, a relative that had repeated fractures, they've probably got an injection for a bone builder. They actively build new bone, but usually you'll switch back to a bone keeper, the Fosamax or the Prolia, later down the track. Their bone builders are pretty powerful, but they can't be used with people with heart conditions either, because they'll lay down a little bit more calcium within the heart. The last one is estrogen helpers. So that's your HRT. Raflaxifene is one of the common ones. RAL OXIFENE.
Can you spell that again?
RAL OXIFENE. These mimic some of the helpful effects of estrogen on bone. They are more niche, useful in certain women, especially closer to menopause, or where breast bone risk needs careful balancing, like breast cancer. More sort of a HRT, hormone replacement therapy in that regard. So if you can, try to avoid the medication as much as possible, and that's why we're here today, to actually get an exercise plan, eat well, avoid the medications. If someone you know ends up in a nursing home or something like that, no doubt there will be probably some injections going on. But again, if you've got good bone density leading up to that, or minimizing your bone loss, then you could avoid that altogether. Right, moving on. Let's talk a little about this. Minimizing bone loss with hormones. So again, we've got this movement here. So this is the same graph as before. When we start off here, we go up and then we come down here and we lose bone rapidly. I'm going to put the age of 60 there, the age of 0 here. We got minus 2.5 here. We got minus 1. We got plus 1 here, minus 2. Again, most of us in the room here are probably round about here, minus 2-ish, I would imagine. So we got osteoblast increase here. And then decrease osteoclast, taking away bone, decreasing bone here as we go. In terms of estrogen hormone replacement, estrogen actually regulates bone turnover. So it keeps osteoclasts, these ones, on the right-hand side under control. So when estrogen drops, when you go through menopause, perimenopause, osteoclast activity actually increases. So we got an increase in the osteoclasts as you go into menopause. So estrogen's... Sorry?
If you've been there for a while, it probably goes faster, doesn't it?
Yes, correct. Yeah. So estrogen supports osteoblasts, bone building. So when you've got a lot of estrogen in your body, you're going to build more bone. Without it, osteoblasts become less active and you build less new bone. So less estrogen, you've got a higher bone turnover with more loss than actual gain. This is why postmenopausal density, Colleen, declines very quickly. Bone in your spine, pelvis and wrist is actually hit the hardest. That kind of bone is metabolically active, so responds quickly to hormonal changes. It kind of explains why spinal fractures are common when you're a bit older. Sort of the bone, the cortical bone, like the hip, also thins over time. you get a weaker femoral neck, and you get a higher hip fracture risk. Menopause causes a shift in calcium handling as well. Lower estrogen reduces intestinal calcium. I think we talked about that in your stomach. So yeah, it reduces calcium absorption in your stomach and increases calcium loss in your urine as well. So there's less calcium available for your bone as well. Also during menopause, things like that, inflammation increases with age, plus low estrogen. There's a high inflammatory cytokines stimulate osteoclasts. So the more inflammation you have in your body, the more active the osteoclasts are as well. And that accelerates bone loss even further. Obviously, sleep and mood changes alter your cortisol levels, your stress levels. So if you're not sleeping well, then that's not good. Chronic higher stress levels are catabolic, which means you'll lose more bone. So yeah, it contributes to more bone and muscle loss. All sounds really great, doesn't it? Muscle decline equals bone decline. So if your muscles are not strong, your bones will decline. If you have less muscle load, the weaker the mechanical stimulus on your bones. And bone stops adapting to stress. We went through stress strain before, and that's basically Wolff's law. So Wolff's law state that you need stress on your bones to grow more bones. How does HRT help? I'm not sure if any of you are on HRT. HRT replaces estrogen, directly inhibits osteoclasts. So really works the HRT on osteoclasts. So stops them being as active. There's less bone breakdown, bone turnover normalizes, and loss of bone slows dramatically. HRT restores osteoblast function to a certain degree. So osteoblasts become more active again. So the actual bone building, we've got a tick for that as well. Where did my pencil not working? There we go. Not in all women, but in some women. And bone density may actually increase a little bit. HRT lowers bone turnover markers. So that's clinically measurable improvements that show bone metabolism actually stabilizing. HRT improves calcium balance also. Estrogen replacement increases intestinal calcium reabsorption in the gut and reduces urinary calcium losses. So you got more calcium for building bones as well. HRT reduces inflammatory markers in the body. So you have lower systemic inflammation, fewer signals that activate bone breaking cells as well. So your gut inflammation is a little bit better as well. And just generally for exercise, HRT improves muscle. You actually get better sleep, energy, symptom control. Women tend to move more, train more, and mechanical load on bones boost.
So should we be asking our doctors about the HRT supplement?
It's an individual thing. It's always a question, that you should ask your doctor, definitely. Generally, HRT works best within 10 years of menopause. And you can go on HRT at any age, and it's quite common to go on HRT if you get UTIs and things as well. But definitely it's worth a conversation with your doctor. If your doctor's GP is not into it, the specialised menopause clinics, I think there's a few down south in Canberra, might be worth a bit of a chat as well. Is it an individual thing? The risks of cancer are no greater than any other cancer risk in the world. That's old news. Old research that was proven to be reportedly incorrect. So it's worth a chat to your GP. Certainly reduces fracture risk. Yeah, so it's best, HRT is best started within the window of opportunity, and that's sort of 10 years of menopause. Earlier start, the stronger the protective mechanism. How are we going for time? All right, we're losing time. Let's build it. Any other questions about hormones? You'll get a replay of this as well, so trying to go through it again. We ready to build it? Let's see what we're going to do. I don't know if you can see the lines on that, can you?
No.
Yeah, need to be a bit darker next time, Dan. Doot, doot, doot. Activity, strength training. This is your weekly schedule. 2 to 3 times a week. If you've got this form, it's good. If not, just write it down on a piece of paper. Mark it out, similar to what we've got here. Monday, Tuesday, Wednesday, Thursday, Friday, Saturday. So we need strength training twice a week. We need loaded, I'll just say loaded movement. And we also need to work on our balance. So if you are exercising in our gym or any other gym twice a week, you've got it covered. If you're not, you need to do something more. So strength training, like we went before, probably need to go through a few exercises, such as lunges, some leg exercise, squats, calf raise. At the bare minimum, they're all sort of standing exercises. If you have problems doing that, you could probably definitely do a sit to stand out of a chair, which is a squat, basically. Lunges are a bit more complex because there's a bit more stress on your knees. But a lunge is probably best bang for your buck exercise. I would do that because it's sort of, if you've got a sore back or something like that, it takes your back out of it and just works your legs. Calf raise is good, keeps your lower body strong. So calf raise, just standing against the wall, just lifting your heels up and down. With those exercises, you probably need to do at least 2 lots of 8. So lunges, 8 each leg. Squats, doing 8, having a rest, do another 8. Calf raises, do 8, have a rest. 8 to 12 is a good range for you. Upper body, we need to row. So if you're familiar in the gym, we do a 1-arm row and a 2-arm row. At home, you could do it with a band, attach it to the door, row with the band. You could also do it with a dumbbell, bent over 1 arm. And for the upper body, we're also looking at some sort of pushing action as well. So you could do a push-up off the wall, push off the wall. That's probably the bare minimum that you could get away with doing at home. In the gym, we use cables to push, we use dumbbells to push, so far superior than actually doing it at home. You sort of want 2 sets of 8. So again, you're rowing with 2 arms, row, doing 8, having a rest, doing another 8. We can do high row as well. And a push would be a push up against a wall or off the ground as well, or off a desk. So we're just putting stress, as we talked about earlier on, just a stress through the bone. A sort of workout like that, 5 exercises would take you about 10 minutes twice a week. You probably do that, you'll probably be fine. If you, of course, are doing some loaded movement. So the bare minimum walking, stairs are better, and rucking is even better. Sorry. And rucking is even better. So walking, stairs, and rucking. Add a little bit of weight to your walk. You'll get far benefits. So you'll increase load on your bones by 3 to 5% if you're actually rucking. And this is daily. This is daily, every day, moving, moving, moving. The strength training is 2 to 3 times a week. Minimum 2, 4 is much better. 2 is minimum. With Elizabeth, we started exercising with Elizabeth when I used to work at Calvary Hospital. I think I was there for 4 or 5 years. Elizabeth started exercising there in classes. That was back in the early 2000s, 1990 something. So definitely Elizabeth has been doing her strength training regularly since then, and obviously the numbers kind of prove it. Balance, we want a heel toe stand. So you're just standing like you're on a tightrope, 1 foot in front of the other, and we want to try and hold that for as long as possible, at least 30 seconds. You can walk with that as well, so you can walk heel toe as well. You could just stand on one leg. The reason why we want to work on balance is because if you fall, you can break something. So we want to minimize falling to stop bones breaking. Stand on one leg, up to 30 seconds, 10 to 30 seconds. Be of benefit. That's it. That's your workout. Not too hard. You got 10 minutes twice a week? I think so.
Balance, how often does that have to be done? Every day? Is it daily or?
The balance, yeah, we'll do balance daily. Yep. Again, takes 30 seconds. So it can be done make sure you're safe when you're doing it, right? So if your balance is not good, make sure you can hold on to something. If you're in a corridor, if you've got a hallway, walls on either side, so you can have hands against the walls, so you can go heel toe and hold it. And then if you tip one way or the other, you can just adjust. That's fine. Or one leg. So just spend 30 seconds, doing that. Sorry, yes, that'll be daily. Let's pick the days. Let's go the easiest ones down the bottom. Why did I put that in Monday? Yeah, anyway. We're going to tick which days we're going to do that. So we're going to do balance every day. Tick, tick. Make that a bit fatter. Tick, tick. Wednesday, Thursday, Friday, Saturday, Sunday. Ticky tick. We're going to do loaded movement every day as well. Now, if you're not as mobile, if you can't walk as much, you try to do 2 or 3 times, or just find some stairs, up and down stairs. But we want to try and do that every day as well. So you can actually plan out, if you're more routine, you can write in what time of day you actually want to do that. So that could be on a Tuesday at 11:30 a.m. That's when you walk, and different days as well. So you plan for that. And so your weights, we want minimum twice a week. So let's go Wednesday and Saturday, and we're going to do a 12 p.m. workout there, a Saturday 10 a.m. as well. So we've got all bases covered. This kind of program would be 2 to 3 months as a good starter. And if you're already doing the weights, then maybe you want to increase the loaded movement. Maybe you want to start rucking. If you're not doing the balance, incorporate the balance. So there's always something there that you're probably not working on regularly. But we want the loaded movement to be regular, because that actually puts a lot of strain on the body, which helps with the osteoblast activity and minimizes the bone loss osteoclasts as well. And the strength training just helps your bones, but also makes you stronger as well. The real benefit of this is you don't actually have to even write it down. You can just press that green button down the bottom. Don't do it now. You see the GPT program builder. You click it, it opens ChatGPT, and I spent a couple of hours building that program. So it'll open ChatGPT. It'll ask you 4 questions. I'm not actually sure if I can share that with you. Oh, yep, here it is.
When can we access that?
Now, don't click on it now.
No.
Because we're chatting, obviously. Yeah, it'll automatically open ChatGPT. And if you haven't got an account, you can still use it. The amount of prompts that you'll put in will be limited. That's the only thing. So you'll have to do it over a period of a few days. So I think when you use it free, you can use, I don't know how many prompts, maybe 3 or 4 prompts. But it'll ask you, it'll have 4 questions that are set up with it, and you can click on either one of them, and then it'll just take you through and build a program for you based on what you input. Pretty straightforward. Really good tool that you can use. That's in the download page as well, the thank you page that I've attached as well. So have a go at that when you have time. It's good fun, and has my kind of humor in it as well. I built it with my humor in it. So all these sort of diagrams of that I get off some other guys who coach in different industries, Jason Pilgrim and Taki Moore. Yeah. Let's build a habit. Let's quickly do this. So we're going over time. You're all good? Extra benefit. Habit goals. So with this, you can download this. This is actually A3. So you can print it out. You can grab one from us as well. We've got them printed off. Habit goal would be exercise. I'm going to say ruck daily. So I'm going to walk with weights daily. Its start date is the 7th. Start date is the 7th of the 12th. Habit frequency daily. So if you're doing it every second day, it'd be twice a week. Streak target, I'm going to do 30 days in a row. As I walk each day, I'm going to mark these off. So I'm going to do it. So every day I'm going to mark it off until I get to 30. I'm going to keep marking off till I get to 30. My key motivations would be to be stronger, get off the ground with my mobility, minimize bone loss. Next steps, how am I going to do it? So I'm going to get up 6 a.m. This is just an example. Clothes on, 6:10. Walk/ruck, 6:15. Back in house, 6:45, just a half-hour walk, and then have shower. So you need to really plan it out. The most important thing is reward. After I've done the 30 sessions, you need a reward. And what's my reward going to be? Buy another pair of basketball shoes. It's one thing we do as humans is we don't reward ourselves very well. So if I haven't done this activity before and I do 30 days in a row of rucking, you want a good reward. And it has to be, generally has to be external. It can't be, oh, I'm going to do some more exercise. No, you have to look towards something, either going out to dinner with a family member, or buying yourself something, treating yourself to a nice dinner, something like that. It has to be really on target. And again, you can grab one of these from us. We can go through it with you as well, if you like. So yeah, they're good fun. All right, getting towards the end, 5-minute fix. Is there anything anybody needs help with right at the moment that we can fix up in 5 minutes really quick?
Do you run any courses like this? Or do you just do them personally or what?
Any courses like this?
Yeah, sort of showing us the exercises.
Oh yeah, I mean, that's what we do every day of the week.
Right.
Yeah, of course.
So you just book in?
Yeah, only take half an hour. You can book in any one of us, and we'll go through 5 exercises for you to do at home. I presume, Colette, you want to do them at home?
Yes.
Yeah.
Why, do you have classes that they do them there?
Of course, yeah. Yep.
But you've got to find time to get there.
What's that?
You've got to find the time that suits you to be able to be there for the classes.
Well, yeah. Yeah, we have set class times. There is 1, 2 people in this chat that come regularly, and then other people that do their own stuff at home. I know 3 people that come regularly, and yeah, and we do some one-on-one sessions with some other people. I'm surprised you didn't get all the emails about classes and stuff back a while ago.
I've got some of them.
Yeah, we can. I'll get Jasmine to send you some info on that, because we do have spots probably lunchtime on a few days, yeah, or afternoon. So yeah, I'll send you some information on that. Yeah. Other than that, you can come in just for a half-hour session with one of us, and we can build a program for you at home. The problem with home exercise is it's very hard, because it's very hard to motivate yourself. Home is actually a place to rest. Even though you're doing housework and things like that, home is actually a place that you go to rest, and you go to do your work in other places, like going to a gym, doing stuff outside and so forth. So that's a difficulty with doing exercise at home. Most people aren't successful. That's why they put gyms in garages, because they're a working area as well. Depends on budget and all that kind of thing. But if we can set you up with some exercises to do at home and see how you go with that to start anyway. Yep. Cool. I'll get Jasmine to send you some info. Anybody else? Sorry. My coffee's still going.
Mine's finished.
Get a delivery. Get some more. Sorry? Yeah.
Where's my Uber?
Yeah, Uber deliveries. Just write down a few things. Your takeaways. What's the main takeaway for today? Is it something to do with your hormone levels? Is it something to do with bone building, your T-score? Is it actually how much exercise? Might be less. You need to do less exercise than what you thought. Is it the amount of protein you actually have to eat? What is a good takeaway for today? What are you going to do over the next couple of weeks before Christmas? Are you going to start tomorrow? I suggest you probably do. Whether you start walking a little bit more tomorrow, doing a bit more balance work tomorrow. Look at your plan. If that initial plan that we did today is not good on a piece of paper, put it on a bigger calendar on the wall. Put it on your digital calendar. But let's try and do something in terms of balance and loading every day with a couple of exercise sessions a week. Communications, do we need to chat more about what you need to do? Like Colette, we had a chat about and what we can do to increase your exercise, whether you do it with us or whether you join a gym or whether you do it at home, whether you do it outside a little bit more. So what are the next communications with that as well? All right. Very good. How are we all looking? I think we're just about done. What do you reckon? Any other questions before we head off for our Sunday? A lazy Sunday. The weather looks not too bad, not as hot as yesterday. Any other questions?
No, thank you.
Any other things? All happy? Got a little bit of a plan, a little bit more knowledge. Let's celebrate with confetti. Oh, so fun. And let's all gather around with some confetti and hearts as well. I want to say thank you for taking your time, especially on a Sunday morning. I'll send you the replay if you want to see yourself down there. There you are. Yeah, and we'll get together. Oh, we've got someone putting some things up as well. Let me get rid of that. Thank you once again for jumping in, and I'll see you in the gym soon, or we'll see you online soon. I'll be doing more workshops with this on different topics. So always jump in. It's good to learning something and actually sitting down and doing something. See, I didn't sell you anything, did I?
Thank you.
All right.
Thanks, Dan.
See ya. Bye.
Thank you. Bye.
Thank you. Bye.
Bye. Onying, you still there? I can't hear you, but water exercise, not as great as land-based exercise. So if you're actually in the water, you're not going to get the loading as much as you would on land, because on land you got gravity as well. Generally exercise good for your cardiorespiratory, so for your heart and your whole lungs. So definitely is in the mix there, but in terms of pure bone building, land exercise is better. But I mean, you're kicking your legs and you're moving through resistance, so you're still getting a bit of strain on the body as well, if that answers that question.
The physiotherapist here recommended doing
Yeah.
the hydro, so did
Yeah.
my GP.
If you're not moving as well on land, then
Focus on land.
yeah.
How to get better.
Yeah. So in the water, it's obviously you can move a little bit better. There's not the fear of falling. There is more energy expended, I think, getting ready for the water, getting in and out, and so forth. Yeah. So that can be the problem with water. But generally, not as good as land-based stuff. But if that's all you can do, then yeah, that.
Well, I think really being in the gym is better. But
yeah, I mean, you're doing that as well.
Recommended to do that.
Yeah, you're doing a lot, Elizabeth. So you're doing all the good stuff. You're doing the gym. You're doing the good stuff.
Getting any better.
Yeah.
I'm getting worse.
Yeah, I think.
My GP on
Yeah.
Wednesday.
Yeah, I think minimising the decline is good. I think that's what you're doing as well. So I think you'd be in a lot worse state if you weren't doing what you're doing.
I'm so dependent upon this wheelie now.
Yeah.
And I'm bent over, as you rightly say.
Yeah.
My body's given out on me.
Yeah. See you, Onying. Thank you. All right, Elizabeth. All right.
Thanks, Daniel.
Be well. Thanks for jumping on. And you did well on the Zoom. Well done. You did well.
Yeah, see, I get tired because I take these
Yeah.
tablets, that
Yeah.
then recommended to take.
Yeah.
But, dearie me.
Yeah.
It's, I've got better things to do than sleep.
Yeah.
Yes.
All right. Take care.
Right, you take care too,
Talk.
Daniel. You got my thing about vitamin.
Yeah, I looked at that. I mean, there is on your supplement. It should say how much B6. Yeah.
It's a very, very small print. Anyway, I've ceased to take it off. I'll talk to the GP.
Yeah.
Wednesday
Yep.
about it.
Fair enough. Okay.
I know. Thanks a lot.
All right.
Well, sorry for the family too.
All right.
Thanks
All
a
right.
lot.
See ya.
Bye.
Bye.